All right, of course, my name is Mosjaro. You're welcome to my channel again. Of course, this series of lecture is going to be practically based on those persons that are writing UBTH entrance examination that's coming up this month. Now, a lot of persons have messaged me that, okay, Mosjaro, give us some few questions that we should be considering as we prepare for this exam. So Mosjaro is always here for you. And of course, for those persons that are writing next year's exam, my series of lecture will soon start, but specifically these videos are for those persons that are writing UBTH exam. Now, for this time frame before your exam comes, there are some questions I'll be revealing on this channel. So as you watch the video, if you have not subscribed before, do well to subscribe so that you get a notification each time I drop a particular video. Now, this question I want to review is from biology. Obviously, I want to start with biology first. Then, of course, this topic is very, very important that the question is coming out from. Of course, you know, I usually do it straight to the point. And as I look at the options, I do well to also take some explanation. That's why you have to tune in to the channel quickly. Mogo, sharp, sharp. Now, they said one of the major cause of hemophilia. Now, I like to look at my terminologies. Now, they said one of the major cause of hemophilia is lack of dash. They said A, fibrinogen, B, amylase, C, white blood corpuscles, D, red blood corpuscles, then E, plasma. Now, obviously, if you tend to look at these very well, properly, the answer is already there staring at you. But like I usually do, I don't jump into the question. Of course, I got to look at each of the options. Now, I know the answer is staring at us. The answer is there, but I want to analyze why is the answer like that? And of course get to look at other options in case you come across it in subsequent questions. So most times people make the mistake of wanting to cram and enter into the no, you don't do that. Now, all you have to do is that anytime you are practicing a particular question, after you must have gone through the question or maybe find out the answer, do well to observe the other options, because that is where some other questions might come out from subsequently. So quickly, let's jump into it. Now, they said one of the major cause of hemophilia is lack of dash. Now, remember, they said one of the major cause, that means hemophilia can also be caused by other situations. But they say, what's the cause of hemophilia? First of all, you have to ask yourself, what is hemophilia? Hemophilia is a disorder in which the blood do not clot. Now, what's clotting of blood? So, what's clotting of blood? When you say blood clot, what does it mean? Now, after an injury, in order to stop bleeding, continuous bleeding, there is a mesh that is formed in order to prevent much blood to be lost. Now, that process is what is clotting of blood. So when you hear clotting of blood, is the stoppage of blood flow after an injury. So a stoppage of what? Of blood flow. So you can easily put it in a way like this: a stoppage of blood flow afterwards an injury. So if the blood do not form that mesh to prevent blood flow, of course the patient gets to lose a lot of blood and is very, very dangerous, and it can lead to death. So the inability of the blood to clot on time, that is what is called what? Hemophilia. So this hemophilia is inability of blood to what? To clot. So when the blood do not clot on time, of course, it can result to what? Serious problem and defect. So that condition where the blood do not clot on time, that is what is regarded as what? As hemophilia. And hemophilia is usually commonly caused as a result of what? Lack of blood protein. And what's that blood protein? Is what? Is fibrinogen. Now, I want to bring out something. There's what we call clotting factor. So we already know what's clotting of blood. Now, we have what we call clotting factor, and we have what we call what? Clotting protein. So if they ask us in the exam, what's the clotting factor of blood? Is what? Is platelets. And obviously, this platelets is also known as what? Is also known as thrombocytes. Platelet is also known as thrombocyte. Now, this platelet is one of the blood cells. So let me break it down like this now. It's time for us to analyze it step by step. Now, look at it. We have blood. Blood is a connective tissue. So another point that you must put at the back of your mind, that blood is practically a what? A tissue. Now, because blood is a tissue, definitely it should be made of cells, right? But hold that knowledge. Now, this blood is made of two portions. We have the solid portion And of course, we have the what? We have the liquid what? The liquid portion. Now, the solid portion of blood are known as blood cells, or you call them what? Or you call them blood corpuscles. While the liquid portion of blood is known as what? Is known as plasma. Now, the major function of this plasma commonly is to transport what? Is to transport nutrients, to transport food particles. Are you there now? Now, the liquid portion of blood is what? Is plasma. Now, look at this plasma here now. Now, I've given you the major function of plasma is to transport what? Food particles. So, after digestion have taken place in the small intestine, of course, from the stomach, small intestine, those food are absorbed into the blood. So, basically, is the plasma that helps to carry it. So is the liquid portion of the blood. Now, this solid portion, there are three parts of the solid portion. So we have the what? The red blood cells, which is also known as the what? The red blood corpuscles. And this red blood cell is also regarded as what? As erythrocytes. Pardon my writing there. It's also known as erythrocytes. So as I'm saying